Hi everybody, Dr. Ahles here. In this short video, we're going to talk about a couple of the most common disorders that we see in the urinary system, and we're also going to talk about how things are a little bit different for males and females when it comes to some of these disorders. So let's start with what we might most commonly think of when we think of a urinary system disorder, and that's urinary tract infections, also known as UTIs. When we think about a urinary tract infection, what is most likely to cause it is when fecal bacteria, so the bacteria that normally live in your digestive tract, end up somehow in the urinary tract. So the most common kind of bacterium that's going to be causing urinary tract infections is E. coli. This is a normal kind of bacteria that lives inside of you. It just doesn't normally live in your urinary tract. So when we're thinking about a UTI, a urinary tract infection, this is something that begins and can progress if not treated. So all of these UTIs start in the urethra, which is the tube, remember, that urine is expelled from the body. If a urinary tract infection is confined to the urethra, we would just call it urethritis. And itis means inflammation, inflammation of the urethra. If we're not able to clear the bacteria from the urethra, it may travel up into the bladder. If a patient has a bladder infection, a UTI in the bladder, we call that cystitis. By this point, we really want to be treating this. We want to make sure that this infection doesn't get higher. As it starts to get higher, we're going to have issues where we're getting into the kidneys. And the kidneys are very delicate. So this is bad news for us. So if we've invaded those urine storage structures in the kidneys, we'd call that pyelitis. But if the infection is in the urine storage structures, it may go all the way into those urine forming structures. When an entire kidney, including the nephrons, are all infected, we call this pyelonephritis. So from beginning to end, different names for where these bacteria are found in a urinary tract infection. If we don't treat a urinary tract infection, especially as we get up into the kidney, this can lead to major problems, not only with the process of urine formation, but ultimately with the potential for permanent kidney damage. So we want to address this infection as swiftly as possible so that we don't see this permanent damage. When we talk about UTIs, it's important to know that UTIs are a lot more common in females than in males. Perhaps the biggest reason for this is because of the locations of the urethra. So the urethra in females goes from the bladder straight into the vaginal area where urine is released. In males, the urethra goes from the bladder through the prostate gland down through the penis until it goes out. When we're thinking about the proximity of the urethra's opening to the anus, where the fecal bacteria would be found, it's much farther in males than it would be in females. That's the primary reason that we see this increase in females compared to males. It is also important to note that females have normal vaginal bacteria, and if that vaginal bacteria happens to include E. coli, it's possible that that could also lead to this infection as well. One other type of urinary tract disorder we're going to talk about are kidney stones. And kidney stones are very similar to the gallstones that we talked about in the digestive system. When we talk about kidney stones, these are going to be made when we have a lot of calcium or magnesium or uric acid, which is something that we usually get rid of inside our urine. When those things crystallize, when they come together and form stones, we call this a kidney stone. There are different places where we could see these kidney stones. Sometimes it's in those urine storage structures, so the renal calyces or that renal pelvis. Where we start to get into a even more painful situation is when that stone gets lodged in the ureters. So we can find them in different places. Luckily, most of them will pass through the ureter without any intervention. They're small enough that it's not a big problem for us. That being said, if they are too large, they'll actually block the flow of urine out of the kidney or through that ureter. And as you would suspect, this is very painful. So if a kidney stone becomes lodged in the ureter, we have a few different ways we can deal with that. Number one, we could surgically remove it. That's kind of worst case scenario. Number two, we would prefer to either use endoscopy, which is where we use a small camera sent through that ureter to find and remove the offending stone, or we might use something called lithotripsy. And lithotripsy, perhaps the most common and the easiest way to deal with kidney stones. Just like we could do with gallstones, if we send strong targeted ultrasound waves directly at this stone will start to shatter into smaller pieces that are able to be passed in urine. So when we think about kidney stones, they're an obstructive force that I could use ultrasound on, or I could go in and manually pull out either with surgery or endoscopically. Things that increase the risk of kidney stones, it should be no surprise that an elevated level of calcium in the blood can lead to this, because notice kidney stones made out of calcium a lot of the time. Obesity can also increase this risk. The best way to prevent kidney stones, drinking more water, high levels of hydration. So as we wrap up our discussion of the urinary system, show your kidneys some love, drink a little more water, and that'll help you prevent those kidney stones.